Hi everybody and welcome to our video series on basics of MSK physical exam. A tiny disclaimer, these videos aim to complement the content seen in class and thus are not meant to replace any didactic material. Nonetheless, enjoy the watch. The first step in the exam of the elbow is the observation. You can start in the frontal view or you can start in the lateral view as well. So check for alignment, angulation, internal rotation, external rotation, and basically just where the limbs lay on the side of the patient. You can look as well at the skin or muscle bulk. The next step is to assess the mobility. So it is done both actively and passively in flexion, extension, pronation, and supination. You can then proceed with the palpation. So usually, we palpate every structure that is pertinent to the case. You can start with the structure or the region that you want, but the most efficient way is to be systematic. So either you go from top to bottom or you go by type of structures, so that way you don't forget anything. Don't forget to palpate for the bursas and for the joint lines, which can also be injured in a traumatic injury or certain health conditions. Frequently reviewing your anatomy is a good way to be good at performing the physical examination. Palpation finally includes the pulses. Next come the rhizome, which stands for resisted isometric muscle contraction or movement. It is a concept that is usually not taught in med school, but frequently used by MSK professionals to assess for muscle or tendon injuries, as well as their attachment to the bones. It is simply done by asking the patient to resist the pressure that you apply, and it is repeated in the relevant directions depending on the history that the patient provided. As you can see, the patient mimics on the left the movement that is evaluated by the professional on the right. You should note that no movement is produced on the side that the professional is evaluating. The final step is to perform the diagnostic test. Here is the valgus test, which will assess the medial collateral ligament. You should palpate the joint line on the medial aspect to give you a sense of the laxity and the range of motion that is created by your test. The more precise you are, the better will be your maneuver. Pain indicates a positive test, so a ligament is there. The same procedure can be done to assess the lateral collateral ligament, but basically your hands just change of roles. The left hand is going to push, and the right hand is going to feel the gap that is going to be created on the lateral aspect of the elbow, and then assess for the laxity. This marks the end of our short video. We hope you enjoyed it. Feel free to contact us for any questions or comments. Thanks for watching.